Hello, this is Dr. Dipanjana Datta, and today we will be talking about the scans that we do during the pregnancy. So, the first scan that you will be probably doing, which is related to chromosomal disorders, would be the 11 to 13 week NT scan. Now, in this 11 to 13 week NT scan, there are major four things that a fetal medicine specialist would be looking for. They will be looking for the NT, which is a fluid filled region at the back of the head of the baby. They will be looking for nasal bone. They will be looking for certain things in the heart and certain things in the which is called the tricuspid regurgitation, and they will be looking at the vein, which is the DV. So these four things are very important because they sort of indicate towards certain disorders. These disorders are mainly the chromosomal disorders. We all have 46 chromosomes, and sometimes in certain cases the fetus might have one more, which is known as 47, or might have one less, like 45. If it is one more, depending on which chromosome it is, like chromosome 21 or 18, then we call it as trisomy 21 or trisomy 18. So these particular scans help us to understand whether there is any such aneuploidy present or not. With these scans, you will be also asked to do a certain blood test, which is called as the maternal serum screening. These are basically hormones which are secreted from the placenta of the baby or from the baby itself that comes into the mother's bloodstream. An algorithm is there wherein the age of the mother, the length of the fetus, the length of the NT, along with these hormonal markers, form an algorithm to understand if that fetus is at risk for trisomy 21 or not. If you are at risk, you will be asked for invasive testings wherein it will be proven whether the fetus actually has the disorders or not. The scan or the maternal serum screening, both of them done in the first trimesters, are called the combined first trimester screening, and in this case it will actually indicate a risk. And if there is a risk, then only a diagnostic test would be done. Similarly, at 20 weeks, you will be asked to do an anomaly scan. In the anomaly scan, the structure of the baby is seen, and there are certain sections of the baby which will be seen. If any abnormality is seen, again, you will be asked to go for an invasive test after a genetic counseling is provided to you. What kind of test, how the test will be done will be explained to you in these counseling sessions. At 22 to 24 weeks, you are asked to do a fetal echo. This picks up if there is any problem in the heart. Understand that none of these fetal phenotypes are 100%, and this is the best we can do for the fetus at that particular gestation. Doing just one scan is not enough because something can come up in the next scan as the fetus is growing. Any genetic testing done would be done through a process called a CVS or an amniocentesis. The reports will be explained to you by a genetic counselor, and depending on the report, you can take further informed decision. To know more, please visit your genetic counselor. Thank you.